Dr. Kavita, is it okay for me to call you Joseph?
Sure, of course.
Sounds good. Thank you so much for joining me today. And I want to introduce myself a little bit first. My name is Emily, and I have been a scientist my entire life, and I'm actually from MGH. I did a little bit of training from MGH, so from the Simchus Research Building. And after I finished my postdoc, I started my own company. It's called Rudiment Medicine. It's about precision skincare. So very excited to meet you today. First question is about your journey. Joseph, you have been the pioneer in digital health, and I know you started as a dermatologist. Tell me a little bit more about your journey. How did you transition from a practitioner to the pioneer in the era of digital health?
Well, where I work at the Mass General Hospital in Boston, Harvard Medical School, and most people have a research focus of some sort. So I originally started after my residency studying skin barrier function. And I don't know, it wasn't quite working out for me. So I had a period of 3 or 4 years when my department chair kept giving me things to do. And one of the things that fell in my lap was digital imaging in dermatology. This is in 1992 or three. So the digital cameras that we were using were quite crude compared to what's in your iPhone today. But once I started working in that area, I just got this sense that there was a lot there. And the idea of having a doctor in one place make a diagnosis when the patient is in another, that was really intriguing. So that became my new thing, and it's just been 35 years of continuing to work on it since. I still do patient care, so I still see patients, and as a dermatologist, I do both. But you're right, I have had this duality to my career for over 3 decades now.
Wow, that's so amazing. Based on your, research and your 30 years of experience in the field, how now, AI is coming into play, and how do you think the combination of digital medicine and AI is helping shaping the future of dermatology and healthcare?
Well, the AI part is really about scanning very large data sets and coming up with patterns. So anything that has to do with pattern recognition is a candidate for doing better with artificial intelligence, depending on the data set to use to train. But conceptually, hard to get cases would be one area. There's, of course, been a fair amount of research, none of it really commercialized successfully that I'm aware of, but in the area of pigmented lesion recognition, melanoma recognition, that's an area. And so anytime there's an imaging device now, you can couple that to an algorithm that helps sort out what that image means. It could be dermoscopy, it could be confocal microscopy, etc. And then there's the part the patient part, which is both giving patients and consumers some guidance as to what's special about their journey. So comparing them with other people like them so that they can come in with maybe the right questions, or maybe they have a head start on what medication might be right for them. Someday maybe we'll get every single case, we'll get the medication right the first try. Right now we have to cycle through things, and then there's the part that I think you're involved in, which is customizing actual medications for people or beauty routines and things like that. So lots and lots of opportunity there.
Getting vast amount of data from both the image side and then on the behavioral side, guiding the patient through AI. So do you see that a lot of new commercialization activity going on in that perspective? And I think you mentioned that a little bit.
Yes, I think there is. I'm not. I don't look at business plans. I'm not a venture capital. I have done a little bit of angel investing over the years. I'm not really active in that way right now, but I do end up seeing a lot going on in this space for sure. And a clue that I look at is that I'm editor-in-chief at a peer-reviewed journal NPJ Digital Medicine, and so we get so many papers that are on the front end of this whole thing and have great commercial opportunities. So there's so much going on. It's absolutely breathtaking, the amount of innovation.
Wow. We're actually submitting a paper in the area about precision biomarker.
Thank you. Yeah.
Yeah, maybe would you mind if I forward the manuscript for you to take a look and
of
you
course.
can give me some advice?
That's part of my job. Yeah.
Thank you so much, Joseph. Okay, next question is about future of dermatology and the era of precision medicine. Do you think this is the future?
Well, yes, of course. I mean, again, there's so many examples as a clinician where I'll just take rosacea, just one example, where someone comes in, it's no problem making the diagnosis. Most times now people can make their own diagnosis, right? They go and check their images out over Chat GPT or what have you. And we reach for one particular medication, metronidazole cream, which in my experience works for about a third of people. I don't know which third, or I wouldn't prescribe it to the other 2/3. So then they end up on something else, sometimes the third or fourth or fifth. So imagine a world where we didn't really need to go through that. We could pinpoint at the time that we make the diagnosis. So that's just one example. There are many like that.
Thank you for sharing that. I'm a early stage company founder, entrepreneur. I want to ask you for some advice, for myself, and also for my peers. So do you have any advice for the next, generation of young people who are doing innovative companies like Rudiment Medicine?
Yeah, I'm sure I do, because I've been at this for a while and I've seen business opportunities come and go. I think most of what I have to tell you won't be surprised to hear. You've probably heard it from other mentors. So one is that timing is everything. Timing is everything, and so you have. I did check your website briefly, so it looks like you have some very interesting products there, and so are you at the right time and the right fit for the market? I would argue probably are. So that's good. But what you have to offer, if it was 7 or 8 years ago, and you and I both know that the core technology of machine learning was there then, but people probably would have looked at it and not paid any attention. So timing is really important. And then, of course, the other one, which, once again, this is probably throwaway advice, but it doesn't. I have seen many entrepreneurs who don't seem to get this. I don't take credit for this, but another colleague of mine, a friend who was a former investment banker, who's retired now, used to say to anybody, are you solving a problem that's important enough that people will pay you to solve it? And will they pay you enough that you can make a profit? So it's a simple way to look at your business. And especially these days when people are all about aggregating community and giving things away to build this and that, you got to stop at one point and say, answer those two questions. Fairly crowded space, beauty. Yeah. So how do you, this is really just for, it's a question for you, which is, how are you differentiating what you're doing from everything else that's out there?
Yeah, right now, Rudiment Medicine is we're commercializing based on collaborations with clinics. So even though we're in the beauty space, I think we're not competing against consumer products per se. We are trying to get into the clinics, and this is a white space for the clinics as well. Because from what we've seen, clinics have skincare brands that being presented to them, but they rarely have a platform. We have a platform. We have a SaaS for the clinics, a SaaS platform plugin. Yeah. So right now, the way we collaborate with clinics is when they get the test. So this is what the test looks like. It's a non-invasive test, and then they can get like a skin sampling. So this is the sample stickers, and they can sample their skin biomarkers, and we do gene expression analysis once we get the sample. And then the clinics, they will then schedule the patient for the follow-up appointment, treatments, skincare recommendations. And it's kind of like a plug-in, because right now, from what I understand, they don't have that system right now. They don't have they don't have a consultation system. So it's pretty much a white space, and we're the first company doing this. And if we execute well and utilizing the right partners, I absolutely think we're going to amplify this really, really well. We're still already seeing, a strong traction in the West Coast right now, in Texas and California.
There have been, that's helpful. There have been, I would say, people have made a run at this sort of thing in the past. Not exactly what you're describing, not exactly, but something similar, where there's you capture some data from a consumer and you customize something for them, and I think what I would say is two things, and I said something about this earlier. One is you're coming in at a time when you actually have some real, let's say this, that some of the things that came before you were a little bit smoke and mirrors. Yes, there was a customization, but what was it based on? It was a little bit hokey. I'm guessing with what you have, you can be very specific and back it up with real analysis. And then the part comes, okay, so now that I know that profile about my patient, what really matters that I do for, it's the part that I think is probably still I would guess, under development, but you got to focus on that, so that it's not just data for data's sake, right? There's a real outcome that comes from it.
Yeah, so what we do is we have a personalized serum also made for the customers. So our customers are clinics, but they have their customers. So the serum is mailed to their clinic, so they can offer this personalized blend for their customer as well. So it's kind of like a patient retention strategy for them as well. The patient come in, they do the test. We also evaluate a 3 month. And in the report, it's going to tell the patient, for example, what are the skin concerns, what are the pathways that you need to work on, and what are the ingredients that are matched with your skin health. And we make that for you. The clinic can distribute the personalized serum for the patient as well. And we're kind of like the back end, SaaS integration, and helping the clinic to schedule the patient and follow the patient's progress every 3 months. And so that's
very exciting.
Yeah.
Well, good luck with it. Thanks for involving me, and I look forward to seeing what comes out. And as I said, we'll amplify as we go along.
Thank you so much, Joseph. I really, really appreciate your time.